Today we will discuss about epilepsy, one of the common neurological disorder. Many of the people are not aware about this disease. My name is Dr. K.K. Jindal. I am Director and HOD Department of Neurology, Max Hospital, Shalimar Bagh. Let us learn more about epilepsy. Epilepsy is a transient, episodic, abnormal activity of the brain in which there is recurrent episodes of epileptic seizures. While in seizures, there is abnormal, excessive electrical activity of the brain that leads to change in the behavior, awareness, or abnormal movements of the body, lasting for few seconds to few minutes. Basically, seizures are of three types. One is epileptic seizure, second one is non-epileptic, and third one is provoked seizure. In epileptic seizures, there is abnormal electrical activity of the brain due to some underlying disease of the brain in the form of either head injury or brain tumor or stroke, or in some cases hereditary factors. While in non-epileptic seizures, the patient have seizures like activity, but there is no electrical activity in the brain. The common examples of non-epileptic seizures are psychogenic seizures or fainting spells. While in provoked seizures, there is abnormal electrical activity of the brain due to some proximate cause like low blood sugar, low calcium, or some other causes. So let us learn, if a person is having epileptic fit or seizure, then how to identify. So most common presentation of the epileptic fit is generalized tonic-clonic movement of the body. Along with this, patient might have frothing from the mouth, he might have tongue bite, and he might have bladder and bowel incontinence. So if you find these kind of symptoms, then patient might have epileptic fit. There are other forms of epileptic fit also in the form of abnormal behavior and lip smacking movements and chewing movements and sudden jerky movements, and patient may have sudden falls also, and sudden abnormal involuntary movement of the one side of the body, or uprolling of the eyeballs, sudden turning of the head towards one side. So these are other various symptoms of the epileptic fits. For diagnosis of epileptic fits, there are various modalities are available, ranging from electroencephalogram, EEG, MRI, CT scan, and in some cases lumbar puncture or CSF study might also be needed, and routine blood investigation are also required. And coming to the treatment part, various anti-epileptic drugs, anti-seizure medications are available, and that to be started once a patient is having seizure. Once patient have a single episode of seizure, then need not to be start on the anti-epileptic drugs, and once a patient has two or more seizures, then we need to put him on the anti-epileptic drugs. There are various misconceptions about epilepsy among the people, so let us clear the things. One of the common misconception is that if a person is having epileptic seizure, then we should put some spoon or some object in his mouth to prevent tongue bite. But this is totally wrong. Rather, by doing this, we can harm the patient. So we should avoid these kind of things. Another misconception about epilepsy is that it is a contagious disease. It spreads by touching or by sharing food with the epileptic patient. It's not true. Epilepsy does not spread by touching or by sharing food with the epileptic patients. One more misconception about epilepsy is that it don't have any treatment. No, it's not true. Epilepsy has a very good treatment options. Around 2/3 patients are well controlled with anti-seizure medications, and in the remaining 1/3 of the patient also there are other treatment modalities in the form of brain surgery, epilepsy surgery, electric nerve stimulations, and some ketogenic diet also. Since I have covered about the myths, so let's talk about the patients who are planning to get married. My advice to them that they should properly disclose about their disease to avoid the late life matrimonial disharmony. Also, the epileptic women with childbearing age who are on anti-epileptic drugs and who want to conceive, want to become pregnant, they need not to worry about the pregnancy outcome, because in most of the cases the outcome of the pregnancy is good. And my advice to them is that they should remain in regular follow-up of their neurologist and their gynecologist, and they should strictly follow the advice of their doctors. Often my patient ask about driving. As epileptic patients are more prone to accident during driving because of epilepsy itself, as well as due to the effect of the medicines. So my advice to them is that they should avoid driving if they have a recent epileptic seizure, preferably up to 3 months of the last epileptic seizure. So in the end, my message to the epileptic patient is that epilepsy is not a social stigma. It's a normal disease like others. It's a treatable disorder. One should consult the doctor regularly and follow the advice properly.